Phlebotomy Study Plan 2026. Question 1. What is the standard ratio of blood to anticoagulant additive in a light blue coagulation tube? Option F 1:1, Option B 5:1, Option C 9:1, Option D 10:1. The correct answer is Option C, 9:1. Light blue coagulation tubes require a 9:1 blood to sodium citrate ratio. This ratio preserves clotting factor measurement without over-anticoagulating the sample. Underfilling the tube changes the ratio and can falsely prolong clotting results. Question 2. Which additive is present in a light blue top tube used for coagulation testing? Option A, sodium heparin. Option B, ethylenediamine tetracetic acid, EDTA. Option C, sodium citrate. Option D, potassium oxalate. The correct answer is Option C, sodium citrate. Sodium citrate prevents clotting by binding calcium while preserving coagulation factors for testing. The tube must be filled properly because the citrate-to-blood ratio directly affects clotting test accuracy. EDTA, heparin, and oxalate tubes use different anticoagulant mechanisms and are not substitutes for routine coagulation studies. Question 3. What should a phlebotomist do if they encounter an unconscious patient in an emergency room with no identification band? Option A, refuse to draw the blood until the patient wakes up and identifies themselves. Option B, assign a temporary unique numeric identifier to the patient according to facility protocol and label tubes accordingly. Option C, use the name written on the patient's personal clothing or belongings. Option D, label the tubes with John Doe and leave the medical record number blank. The correct answer is Option B, assign a temporary unique numeric identifier to the patient according to facility protocol and label tubes accordingly. An unidentified emergency patient may receive a temporary unique identifier under facility protocol. Specimens are labeled with that identifier so testing can proceed while maintaining traceability. Clothing, belongings, or generic names are unsafe sources of identity. Question 4. What color top tube contains the additive EDTA and is the primary tube used for a complete blood count? CBC. Option A, lavender top. Option B, light blue top. Option C, green top. Option D, gray top. The correct answer is Option A, lavender top. Lavender tubes contain EDTA and are the primary tubes for CBC testing. EDTA prevents clotting while preserving blood cells for accurate counts. Serum or heparin tubes do not provide the standard specimen required for routine CBC analysis. Question 5. What is the correct protocol for mixing an additive tube after filling? Option A, shake it vigorously up and down 5 times. Option B, roll it back and forth between your palms for 30 seconds. Option C, invert it gently back and forth the recommended number of times. Option D, let it sit completely still in a rack to mix naturally. The correct answer is Option C, invert it gently back and forth the recommended number of times. Additive tubes must be mixed by gentle inversion the number of times recommended for that tube. This ensures blood contacts the additive without causing mechanical cell damage. Shaking, rolling, or leaving the tube unmixed can lead to hemolysis or clot formation. Question 6. What is the clinical name for the stoppage of bleeding from a damaged blood vessel? Option A, hemostasis. Option B, homeostasis. Option C, hemolysis. Option D, hemoconcentration. The correct answer is Option A, hemostasis. Hemostasis is the process that stops bleeding after vessel injury. It involves vascular constriction, platelet plug formation, and coagulation. Homeostasis is broader internal balance, while hemolysis and hemoconcentration are specimen or blood changes. Question 7. Which of the following options defines the proper site for performing a venipuncture on a patient's hand? Option A, the ventral aspect of the wrist near the radial artery. Option B, the dorsal aspect of the hand, focusing on the dorsal venous network. Option C, the inside aspect of the thumb pathway. Option D, the lateral borders of the palm. The correct answer is Option B, the dorsal aspect of the hand, focusing on the dorsal venous network. Hand venipuncture is performed on the dorsal venous network on the back of the hand. These veins are superficial and require careful anchoring and a shallow angle. The palm, wrist, or underside of the hand carries more risk and is not preferred. Question 8. Which organization regulates safety conditions in the workplace, including exposure to blood-borne pathogens? Option A, CDC. Option B, FDA. Option C, OSHA. Option D, CLSI. The correct answer is option C, OSHA. OSHA sets and enforces workplace safety requirements, including rules for blood-borne pathogen exposure. These standards address training, protective equipment, sharp safety, and exposure control plans. CDC and CLSI provide guidance, but OSHA is the regulatory enforcement agency for workplace safety. Question 9. Which department of the laboratory processes a comprehensive metabolic panel, CMP? Option A, hematology. Option B, microbiology. Option C, clinical chemistry. Option D, blood bank. The correct answer is option C, clinical chemistry. A comprehensive metabolic panel measures chemistry analytes such as electrolytes, glucose, kidney markers, proteins, and liver-associated enzymes. These tests are processed in clinical chemistry. Hematology, microbiology, and blood bank perform different categories of testing. Question 10. Which of the following parameters is evaluated when performing a basic metabolic panel, BMP? Option A, hemoglobin and hematocrit levels. Option B, the electrolytes, blood urea nitrogen, creatinine, and glucose. Option C, coagulation factor levels and platelet function. Option D, bacterial growth over a 48-hour incubation period. The correct answer is option B, electrolytes, blood urea nitrogen, creatinine, and glucose. A basic metabolic panel evaluates electrolytes, glucose, blood urea nitrogen, creatinine, and related chemistry values. It is used to assess kidney function, acid-base status, and metabolic balance. Liver enzymes, cardiac markers, and hematology counts belong to other panels or departments. Question 11. Which of the following steps is part of the proper protocol for performing a newborn screening? PKU, collection. Option A, layering multiple drops of blood onto a single filter paper circle. Option B, touching the filter paper directly to the infant's heel puncture site to absorb blood into the circles. Option C, using a capillary tube to collect blood and then smearing it across the card. Option D, wiping the filter paper card with isopropyl alcohol before applying blood. The correct answer is option B, touching the filter paper directly to the infant's heel puncture site to absorb blood into the circles. Newborn screening cards should be filled by allowing blood to soak directly from the heel drop into the filter paper circles. The paper should not be pressed hard against the skin or layered repeatedly. Proper saturation through the paper is essential for valid screening. Question 12. What is the modern medical term for a condition characterized by an abnormally low white blood cell count? Option A, leukocytosis. Option B, leukopenia. Option C, thrombocytopenia. Option D, polycythemia. The correct answer is option B, leukopenia. Leukopenia means an abnormally low white blood cell count. It may indicate marrow suppression, infection effects, medication effects, or immune compromise depending on context. Leukocytosis is high white blood cells, while thrombocytopenia and polycythemia refer to platelets and red cell mass. Question 13. Which of the following elements must be matched precisely between a patient's requisition sheet and their wristband? Option A, patient's first name, last name, and unique medical record number. Option B, patient's room number and name of their primary insurance carrier. Option C, name of the ordering physician and the date the patient was admitted. Option D, patient's diagnosis code and home phone number. The correct answer is option A, patient's first name, last name, and unique medical record number. The requisition and wristband must match the patient's name and unique medical record number or equivalent identifier. Matching these identifiers confirms that the order belongs to the patient being drawn. Insurance, diagnosis, and physician information do not establish patient identity at the bedside. Question 14. A specimen for a lactic acid test must be handled using which special accommodation? Option A, placed immediately on an ice slurry. Option B, incubated at 37 degrees Celsius until tested. Option C, kept away from all light sources using foil. Option D, centrifuged immediately within 5 minutes of draw. The correct answer is option A, placed immediately on an ice slurry. Lactic acid specimens are commonly chilled promptly to slow cellular metabolism after collection. Continued glycolysis can change lactate concentration if handling is delayed. Light protection or warming is used for different analytes, not routine lactate preservation. Question 15. What is the function of the systemic circulatory system? Option A, moving blood exclusively between the heart and the lungs for gas exchange. Option B, routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Option C, filtering liquid waste products through the nephron beds of the kidneys. Option D, producing white blood cells within the flat bones of the axial skeleton. The correct answer is option B, routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Systemic circulation delivers oxygenated blood and nutrients from the left side of the heart to body tissues. It also returns deoxygenated blood and metabolic waste products back toward the right side of the heart. Pulmonary circulation is limited to blood flow between the heart and lungs. Question 16. If a phlebotomist notes that a patient has an active hematoma in the right antecubital area, where should they draw blood? Option A, distal to, below, the hematoma in the right arm, or use the left arm. Option B, directly through the center of the active hematoma swelling. Option C, proximal to, above, the hematoma on the upper right arm. Option D, from the foot on the same side as the hematoma. The correct answer is option A, distal to, below, the hematoma in the right arm, or use the left arm. An active hematoma contains pooled blood outside the vessel and should not be punctured. The opposite arm is preferred, or a site distal to the hematoma may be used if appropriate and permitted. Drawing through the swelling can contaminate the sample and worsen bruising. Question 17. What is the definition of fomite in an infection control context? Option A, an insect that transmits a virus. Option B, an inanimate object capable of harboring and transmitting infectious agents. Option C, a chemical agent used to sanitize skin surfaces. Option D, a specific type of airborne droplet nucleus. The correct answer is option B, an inanimate object capable of harboring and transmitting infectious agents. A fomite is a non-living object that can carry infectious material from one person or surface to another. Examples include bed rails, equipment, pens, and contaminated trays. Vectors are living carriers, while antiseptics and airborne particles describe different infection control concepts. Question 18. What type of hazard is represented by the yellow quadrant of the NFPA 704 diamond? Option A, health hazard. Option B, flammability hazard. Option C, instability or reactivity hazard. Option D, specific or special hazard. The correct answer is option C, instability or reactivity hazard. The yellow quadrant of the NFPA 704 diamond represents instability or reactivity. It warns how readily a material may react, decompose, or explode under certain conditions. Health, flammability, and special hazards are shown in the other quadrants. Question 19. Which of the following parameters can cause a false decrease in bilirubin levels if a sample is handled improperly? Option A, over-isotonic chilling. Option B, exposure to direct room light or sunlight. Option C, inverting the tube more than 10 times. Option D, delays in serum separation beyond 4 hours. The correct answer is option B, exposure to direct room light or sunlight. Light exposure breaks down bilirubin and can produce falsely decreased results. Specimens for bilirubin testing should be protected from strong light soon after collection. Chilling, inversion count, or routine separation delays do not cause the same light-driven degradation. Question 20. Which of the following tests requires a 24-hour urine collection? Option A, culture and sensitivity, C and S. Option B, creatinine clearance. Option C, routine chemical urinalysis. Option D, pregnancy HCG confirmation. The correct answer is option B, creatinine clearance. Creatinine clearance testing often requires a 24-hour urine collection to measure renal clearance over time. The timed urine result is usually paired with a blood creatinine level. Routine urinalysis, pregnancy testing, and cultures use different urine collection methods. Question 21. What type of vessel links the smallest arterial pathways with the smallest venule pathways? Option A, capillary. Option B, sinusoid. Option C, lymph duct. Option D, deep artery. The correct answer is option A, capillary. Capillaries connect arterioles and venules and provide the main exchange surface between blood and tissues. Their thin walls allow movement of gases, nutrients, and wastes. Arteries and lymph ducts perform different transport functions. Question 22. What does a trough level measure in therapeutic drug monitoring, TDM? Option A, the highest concentration of the drug in the patient's system. Option B, the lowest concentration of the drug, measured right before the next dose. Option C, the average concentration of the drug over a 24-hour window. Option D, the amount of drug excreted through the kidneys. The correct answer is option B, the lowest concentration of the drug, measured right before the next dose. A trough level measures the lowest drug concentration, usually just before the next scheduled dose. Timing is critical because the result guides dosing safety and therapeutic effectiveness. Peak levels measure the highest concentration after dosing and answer a different clinical question. Question 23. Which of the following procedures describes the correct method for transporting an ammonia specimen to the laboratory? Option A, keep the tube warm inside an incubator at 37 degrees Celsius. Option B, place the tube immediately into an ice and water slurry to chill it completely. Option C, wrap the tube tightly in heavy foil to prevent any exposure to room lights. Option D, maintain the tube at a room temperature of exactly 25 degrees Celsius. The correct answer is option B. Place the tube immediately into an ice and water slurry to chill it completely. Ammonia specimens must be chilled promptly in an ice and water slurry and transported quickly. Delayed or warm handling can allow ammonia levels to rise in the specimen. Light protection and warm incubation are used for different tests. Question 24. What is the main reason for avoiding blind probing or sweeping when attempting to locate a vein? Option A, it breaks the vacuum seal of the multisample tube. Option B, it can cause permanent damage to underlying nerves and blood vessels. Option C, it dulls the needle tip and makes skin entry painful. Option D, it causes the patient's blood pressure to spike excessively. The correct answer is option B. It can cause permanent damage to underlying nerves and blood vessels. Blind probing or sweeping moves the needle through tissue without knowing where the tip is. This can damage nerves, arteries, tendons, and surrounding soft tissue. If blood flow is not obtained with minor adjustment, the attempt should be stopped and reassessed. Question 25. What type of fire extinguisher should be used on an electrical fire occurring in a laboratory centrifuge? Option A, Class A. Option B, Class B. Option C, Class C. Option D, Class D. The correct answer is option C, Class C. Class C extinguishers are used for energized electrical equipment. They are designed to suppress fire without conducting electricity back to the user. Water-based Class A extinguishers can be dangerous on electrical fires. Question 26. What type of patient environment requires protective, reverse, isolation protocols? Option A patient with an active, contagious respiratory flu virus. Option B, a patient with an open, draining MRSA wound infection. Option C, a patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Option D, a patient with suspected food poisoning or viral gastroenteritis. The correct answer is option C, a patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Protective or reverse isolation is used for patients with severely weakened immune systems. The goal is to protect the patient from microorganisms carried by staph. visitors, and the environment. Patients with contagious infections generally require standard, contact, droplet, or airborne precautions instead. Question 27. Which of the following conditions can cause a specimen to be rejected due to icterus? Option A. Falsely high fats in the patient's diet. Option B. High concentrations of bilirubin in the serum or plasma sample. Option C. Excessive destruction of red cells inside the tube due to rough handling. Option D. Utilizing the wrong color top tube during collection. The correct answer is option B. High concentrations of bilirubin in the serum or plasma sample. Icterus describes a yellow to amber serum or plasma appearance caused by high bilirubin concentration. It can interfere with certain laboratory methods and may lead to rejection or result comments depending on severity. Lipemia and hemolysis create cloudy or red appearances rather than bilirubin-related discoloration. Question 28. What is the correct order of draw for a capillary puncture when collecting multiple microcollection tubes? Option A. Serum tubes, heparin tubes, EDTA tubes. Option B. EDTA tubes, other additive tubes, serum tubes. Option C. Heparin tubes, EDTA tubes, serum tubes. Option D. Serum tubes, EDTA tubes, heparin tubes. The correct answer is option B. EDTA tubes, other additive tubes, serum tubes. Capillary order of draw places EDTA specimens first, followed by other additive tubes and then serum tubes. This order helps prevent microclot formation in small volume hematology specimens. Venipuncture order cannot simply be applied to skin puncture collections. Question 29. If a phlebotomist encounters an outpatient who is hyperventilating and trembling with severe anxiety before a draw, what should they do? Option A. Proceed immediately to get the draw over with quickly. Option B. Instruct the patient to take slow, deep breaths and offer reassurance. Option C. Reschedule the test for a different week. Option D. Administer a sedative if available in the room. The correct answer is option B. Instruct the patient to take slow, deep breaths and offer reassurance. Severe anxiety and hyperventilation should be addressed before attempting venipuncture. Calm reassurance and slow breathing can reduce the risk of syncope, movement, or panic during the draw. Proceeding quickly or administering medication is not appropriate for a phlebotomist. Question 30. Which of the following factors can cause a false decrease in a patient's serum glucose measurement? Option A. Separating the serum from the red blood cells within 30 minutes of collection. Option B. Leaving the uncentrifuged specimen tube at room temperature for over 2 hours, allowing cells to consume glucose via glycolysis. Option C. Transporting the specimen to the laboratory on an ice slurry. Option D. Utilizing a gray top tube containing sodium fluoride to collect the sample. The correct answer is option B. Leaving the uncentrifuged specimen tube at room temperature for over 2 hours, allowing cells to consume glucose via glycolysis. Glucose can fall falsely when an uncentrifuged specimen sits at room temperature because cells continue to metabolize glucose. This ongoing glycolysis lowers the measured concentration over time. Prompt separation or collection in a fluoride-containing tube helps prevent the decrease. Question 31. A phlebotomist needs to collect a specimen for a complete blood count, CBC. Which color tube should be selected? Option A. Red. Option B. Green. Option C. Light blue. Option D. Lavender. The correct answer is option D. Lavender. CBC testing requires anticoagulated whole blood with preserved cellular morphology and accurate cell counts. Lavender tubes contain EDTA, which binds calcium and prevents clotting while maintaining blood cell detail. Serum, citrate, or heparin tubes can alter hematology results or create unsuitable specimens. Question 32. A fasting specimen requires that the patient does not consume food or beverages, except water, for how many hours prior to collection? Option A. 2 to 4 hours. Option B. 4 to 6 hours. Option C. 8 to 12 hours. Option D. 18 to 24 hours. The correct answer is option C. 8 to 12 hours. Many fasting specimens require 8 to 12 hours without food or beverages other than water. This window helps remove recent dietary effects on glucose, lipids, and related analytes. Shorter fasting may not stabilize results, while much longer fasting can create other metabolic changes. Question 33. What type of glove material should be used if a patient or phlebotomist has a documented type I hypersensitivity allergic reaction? Option A, powdered latex. Option B, non-powdered latex. Option C, nitrile or vinyl. Option D, cotton utility gloves. The correct answer is option C, nitrile or vinyl. Type I latex hypersensitivity can cause serious allergic reactions, so latex gloves should be avoided. Nitrile or vinyl gloves provide barrier protection without latex protein exposure. Cotton gloves do not provide adequate protection for blood collection. Question 34. What type of hazard does the blue quadrant of the NFPA 704 diamond represent? Option A, flammability hazard. Option B, reactivity hazard. Option C, health hazard. Option D, special or specific hazard. The correct answer is option C, health hazard. The blue quadrant of the NFPA 704 diamond represents health hazard severity. It communicates the potential for harm from exposure to the material. Red indicates flammability, yellow indicates instability, and white is used for special hazards. Question 35. What should a phlebotomist do when a multisample vacuum tube fails to fill with blood during a draw? Option A, gently advance or pull back the needle slightly to ensure it is in the lumen. Option B, remove the needle completely and start over on the other arm. Option C, leave the tube in place for 3 minutes to allow the vacuum to recover. Option D, push the needle deeper at a 90-degree angle. The correct answer is option A, gently advance or pull back the needle slightly to ensure it is in the lumen. A vacuum tube that fails to fill may indicate the needle bevel is against the vein wall or not fully in the lumen. A small adjustment forward or backward can restore flow without unnecessary reinsertion. Pushing deeply or waiting for the vacuum to recover can injure tissue and waste time. Question 36. What should a phlebotomist do if they note a discrepancy between the patient's verbal name and the name on the pre-printed lab requisition? Option A, change the requisition manually using a pen to match the verbal statement. Option B, contact the supervisor or ordering nurse to resolve the issue before drawing blood. Option C, draw the blood and sort out the labeling discrepancy later in the lab. Option D, assume the patient knows their own name and print a new label on the spot. The correct answer is option B, contact the supervisor or ordering nurse to resolve the issue before drawing blood. Any mismatch between the patient's statement and the requisition must be resolved before collection. Proceeding with unresolved identity information can create a wrong patient specimen and unsafe results. The phlebotomist should involve the supervisor, nurse, or ordering provider according to policy. Question 37. What type of specimen is generated when a blood sample collected in a plain red top tube is allowed to clot and then centrifuged? Option A, plasma. Option B, serum. Option C, whole blood. Option D, fibrinogen-rich extract. The correct answer is option B, serum. Serum is produced when blood is allowed to clot and the clotted specimen is centrifuged. It is the liquid portion remaining after fibrinogen and clotting factors are consumed in clot formation. Plasma requires an anticoagulant and still contains clotting factors. Question 38. Which of the following conditions describes a vein that feels hard, cord-like, and lacks resiliency? Option A, patent vein. Option B, sclerosed vein. Option C, superficial vein. Option D, tortuous vein. The correct answer is option B, sclerosed vein. A sclerosed vein feels hard, cord-like, and poorly resilient because of scarring or repeated irritation. Such veins may not accept a needle well and can yield poor flow. A patent vein is open and resilient, while tortuous veins are winding rather than necessarily hardened. Question 39. What is the primary purpose of the laboratory safety data sheets, SDS? Option A, to track the daily attendance and performance records of employees. Option B, to provide detailed information regarding chemical hazards, handling, and first aid measures. Option C. To schedule the preventative maintenance routines for centrifuge machines. Option D. To log the critical panic values reported to physicians. The correct answer is option B. To provide detailed information regarding chemical hazards, handling, and first aid measures. Safety data sheets provide essential information about chemical hazards, safe handling, storage, spill response, and first aid. They support employee safety and emergency response in the laboratory. They do not track attendance, equipment schedules, or critical value reporting. Question 40. What clinical condition is characterized by a high accumulation of bilirubin in the blood, causing a yellowing of the skin and sclera? Option A. Cyanosis. Option B. Jaundice, icterus. Option C. Erythema. Option D. Pallor. The correct answer is option B. Jaundice, icterus. Jaundice, also called icterus, results from elevated bilirubin levels in blood and tissues. It causes yellow discoloration of the skin and sclera. Cyanosis, erythema, and pallor describe blue, red, and pale color changes from different causes. Question 41. What is the function of platelets, thrombocytes, in the human body? Option A. Transporting carbon dioxide back to the pulmonary system. Option B. Producing specific antibody proteins to neutralize viral particles. Option C. Participating in primary hemostasis by aggregating to form a platelet plug. Option D. Maintaining systemic core body temperature variations. The correct answer is option C. Participating in primary hemostasis by aggregating to form a platelet plug. Platelets support primary hemostasis by adhering to damaged vessel surfaces and aggregating into a platelet plug. They also provide a surface for coagulation reactions that stabilize clot formation. Red cells carry gases, and leukocytes provide immune defense. Question 42. Which of the following practices is an example of an engineering control to prevent blood-borne pathogen exposure? Option A. Wearing a face shield when opening specimen tubes. Option B. Utilizing a sharps container with a wide, drop-in opening and safety needle shields. Option C. Washing hands with antimicrobial soap for 20 seconds. Option D. Following a strict order of draw sequence. The correct answer is option B. Utilizing a sharps container with a wide, drop-in opening and safety needle shields. Sharps containers with safe openings and safety needle shields are engineering controls because they isolate or remove the hazard by design. These devices reduce needle stick risk during and after collection. Gloves and training are important but do not physically engineer the hazard away. Question 43. Which of the following represents an occupational exposure route for a blood-borne pathogen? Option A. Blood splashing into a phlebotomist's eyes. Option B. Touching an intact skin surface with clean hands. Option C. Inhaling air in a well-ventilated laboratory room. Option D. Spilling saline solution onto a lab bench. The correct answer is option A. Blood splashing into a phlebotomist's eyes. Blood splashing into the eyes is an occupational exposure because mucous membranes can transmit blood-borne pathogens. Eye protection is used when splash risk exists to prevent this route of exposure. Contact with intact skin or clean surfaces does not carry the same exposure risk. Question 44. What does the term homeostasis mean? Option A. The stoppage of blood flow from an injured vessel. Option B. The steady state or dynamic balance of the body's internal environment. Option C. The destruction of old red blood cells in the spleen. Option D. The production of new cellular elements in the bone marrow. The correct answer is option B. The steady state or dynamic balance of the body's internal environment. Homeostasis is the body's dynamic process of maintaining internal stability. It includes regulation of temperature, fluids, pH, glucose, and other physiologic variables. Hemostasis is specifically the stopping of bleeding and is a different term. Question 45. What is the function of sodium polyent whole sulfonate, SPS, inside a yellow top blood culture tube? Option A. To inhibit the growth of bacteria. Option B. To preserve glucose levels for bacterial metabolism. Option C. To aid in bacterial recovery by inhibiting complement and phagocytosis. Option D. to lyse red blood cells to release intracellular pathogens. The correct answer is option C, to aid in bacterial recovery by inhibiting complement and phagocytosis. SPS helps blood culture recovery by inhibiting complement, phagocytosis, and some antimicrobial activity in the specimen. This supports survival of microorganisms until incubation and analysis. It is not intended to kill bacteria or preserve glucose for chemistry testing. Question 46. What is the primary purpose of the multisample needle's rubber sleeve? Option A, to cushion the patient's vein from sudden movements. Option B, to prevent blood from leaking into the tube holder adapter between tube changes. Option C, to keep the needle sharp until it enters the vein. Option D, to guide the needle into the exact center of the vacuum tube. The correct answer is option B, to prevent blood from leaking into the tube holder adapter between tube changes. The rubber sleeve on a multisample needle seals the back end of the needle between tube changes. This prevents blood from leaking into the holder and reduces exposure risk. It does not guide the needle into the vein or protect the vein from movement. Question 47. What is the correct site for performing a dermal puncture on an adult patient's finger? Option A, the exact center of the finger pad on the index finger. Option B, the fleshy, off-center side of the distal segment of the middle or ring finger. Option C, the side of the pinky finger close to the nail bed. Option D, the palmar crease of the thumb. The correct answer is option B, the fleshy, off-center side of the distal segment of the middle or ring finger. Adult finger puncture is performed on the fleshy, off-center side of the distal segment of the middle or ring finger. This location provides good capillary flow while avoiding bone and heavy nerve concentration. The center pad, thumb, index finger, pinky, and nail areas are less desirable. Question 48. Which of the following tubes contains an additive that preserves cellular morphology for a differential blood smear? Option of light blue top. Option B, lavender top, EDTA. Option C, gray top. Option D, green top. The correct answer is option B, lavender top, EDTA. Lavender EDTA tubes preserve cellular morphology for differential counts and blood smears. EDTA prevents clotting without causing major distortion of white blood cell appearance when smears are prepared promptly. Citrate, fluoride, and heparin tubes are not preferred for routine differential morphology. Question 49. What does the acronym PASS stand for in relation to fire extinguisher operation? Option A, pull, aim, squeeze, sweep. Option B, push, aim, slice, secure. Option C, pull, activate, squeeze, shake. Option D, press, aim, secure, sweep. The correct answer is option A, pull, aim, squeeze, sweep. PASS stands for pull, aim, squeeze, and sweep. This sequence describes the basic operation of a portable fire extinguisher. Using the wrong sequence can waste time and reduce effectiveness during a small controllable fire. Question 50. What type of fire hazard is represented by the red quadrant of the NFPA 704 diamond? Option A, flammability hazard. Option B, health hazard. Option C, reactivity hazard. Option D, specific hazard. The correct answer is option A, flammability hazard. The red quadrant of the NFPA 704 diamond indicates flammability hazard. It communicates how readily a material can ignite. Blue represents health, yellow represents instability, and white indicates special hazard information. Question 51. What type of protective equipment must be worn when performing a venipuncture on a patient with droplet precautions? Option A, an N95 respirator mask and shoe covers. Option B, a standard surgical mask and gloves. Option C, a full body Tyvek suit and goggles. Option D, no personal protective equipment is required. The correct answer is option B, a standard surgical mask and gloves. Droplet precautions require a surgical mask, and gloves are used for venipuncture under standard precautions. The mask protects mucous membranes from large respiratory droplets during close contact. N95 respirators are reserved for airborne precautions. Question 52. What is the correct protocol for an inpatient who is sleeping when the phlebotomist arrives to draw blood? Option A. Draw the blood quietly without waking them up to minimize pain. Option B. Gently wake the patient, identify them properly, and explain the procedure before proceeding. Option C. Skip the patient and mark them as unavailable on the computer. Option D. Ask the patient's roommate to confirm their identity for you. The correct answer is option B. Gently wake the patient, identify them properly, and explain the procedure before proceeding. A sleeping inpatient must be awakened and identified before collection. The phlebotomist should explain the procedure and obtain cooperation when possible. Drawing quietly without waking the patient prevents proper identification and consent. Question 53. When instructing a patient on how to collect a clean catch midstream urine sample, what is a key step? Option A. Voiding directly into the cup without any prior cleaning steps. Option B. Cleansing the genital area with an antiseptic wipe, voiding a small amount into the toilet, and then catching the middle portion of the stream in the cup. Option C. Saving all urine voided over a continuous 24-hour window in a refrigerated jug. Option D. Restricting fluid intake for 48 hours prior to voiding the sample. The correct answer is option B. Cleansing the genital area with an antiseptic wipe, voiding a small amount into the toilet, and then catching the middle portion of the stream in the cup. Clean catch midstream collection reduces contamination from skin and genital flora. The patient cleanses first, begins voiding into the toilet, and then collects the middle portion of the urine stream. Collecting the first urine directly into the cup increases contamination risk. Question 54. What tube additive prevents clotting by binding or chelating calcium? Option A. Lithium heparin. Option B. DDTA. Option C. Sodium polyant whole sulfonate. Option D. Thrombin. The correct answer is option B. EDTA. EDTA prevents clotting by chelating calcium, a required cofactor in the coagulation cascade. This makes it especially useful for hematology testing where cells must remain unclotted. Heparin inhibits thrombin activity, SPS supports blood culture recovery, and thrombin promotes clotting rather than preventing it. Question 55. What is the primary function of the circulatory system's capillaries? Option A. Transporting blood under high pressure away from the ventricles. Option B. Permitting the exchange of nutrients, gases, and waste products between blood and tissue cells. Option C. Directing large units of blood directly into the vena cava pathways. Option D. Preventing the backflow of lymph fluid into the deep tissues. The correct answer is option B. Permitting the exchange of nutrients, gases, and waste products between blood and tissue cells. Capillaries are the exchange vessels of the circulatory system. Their thin walls permit transfer of oxygen, carbon dioxide, nutrients, and waste products between blood and tissues. Arteries and veins mainly transport blood to and from capillary beds. Question 56. What type of consent is demonstrated when an adult outpatient rolls up their sleeve and extends their arm toward the phlebotomist after being asked for a blood draw? Option A. Expressed consent. Option B. Informed consent. Option C. Implied consent. Option D. Statutory consent. The correct answer is option C. Implied consent. Rolling up a sleeve and extending the arm after being asked to provide a specimen demonstrates implied consent. The patient's actions show cooperation with a routine procedure. Signed informed consent is a more formal process used when required by policy or procedure risk. Question 57. Chain of custody protocols are required for which type of laboratory specimens? Option A. Routine lipid panels. Option B. Therapeutic drug monitoring. Option C. Paternity and forensic drug testing. Option D. Blood cultures for sepsis. The correct answer is option C. Paternity and forensic drug testing. Chain of custody is required when the specimen may be used as legal evidence or to establish identity. Forensic drug testing and paternity testing require documentation of collection, handling, transfer, and receipt. Routine clinical tests do not usually require that level of legal tracking. Question 58. Hemoconcentration can be caused by which of the following actions? Option A, leaving the tourniquet on for longer than 1 minute. Option B, using a needle that is too small for the vein. Option C, inverting the collection tubes too slowly. Option D, puncturing the skin before the alcohol is dry. The correct answer is option A, leaving the tourniquet on for longer than 1 minute. Prolonged tourniquet application traps blood in the limb and allows fluid to shift out of the vessels. This concentrates cells and analytes, producing hemoconcentration and potentially misleading results. Needle size, tube inversion speed, and wet alcohol cause different specimen problems such as hemolysis or contamination. Question 59. What is the most appropriate step to ensure compliance with quality control measures regarding point-of-care testing? POCT, instruments. Option A, calibrating the machine once every year. Option B, running control solutions at scheduled intervals according to facility protocol. Option C, cleaning the display screen with water after every patient test. Option D, trusting the automated self-check system without external verification. The correct answer is option B, running control solutions at scheduled intervals according to facility protocol. Point-of-care testing requires routine quality control to confirm the instrument and reagents are performing properly. Running controls according to manufacturer and facility schedules helps detect problems before patient results are reported. Relying only on automated self-checks or annual calibration is not sufficient. Question 60. What is the primary function of leukocytes? Option A, carrying oxygen to body tissues. Option B, preventing blood loss through clotting. Option C, defending the body against foreign pathogens. Option D, maintaining osmotic pressure in the plasma. The correct answer is option C, defending the body against foreign pathogens. Leukocytes are white blood cells that defend against infection and foreign material. They include several cell types involved in immune response, inflammation, and pathogen destruction. Red cells transport oxygen, platelets support clotting, and plasma proteins help maintain fluid balance. Question 61. Which of the following tubes is typically selected for a zinc, copper, or trace element determination? Option A, royal blue top tube. Option B, lavender top tube. Option C, light blue top tube. Option D, grey top tube. The correct answer is option A, royal blue top tube. Royal blue top tubes are designed for trace element testing such as zinc and copper. They minimize contamination from tube components that could falsely elevate trace metal results. Routine additive tubes are not manufactured to the same low contamination standards. Question 62. Which of the following options defines the proper site for an adult capillary puncture? Option A, the thumb or index finger of the dominant hand. Option B, the lateral or medial plantar surface of the heel. Option C, the palmar surface of the distal segment of the middle or ring finger. Option D, the side of the pinky finger near the cuticle. The correct answer is option C, the palmar surface of the distal segment of the middle or ring finger. Adult capillary puncture is performed on the palmar surface of the distal segment of the middle or ring finger. These sites provide good blood flow and avoid bone, tendons, and heavily used thumb or index finger surfaces. The pinky and areas near the nail bed are more prone to injury or poor flow. Question 63. What type of vessel carries oxygenated blood away from the heart to the systemic tissues? Option A, artery. Option B, vein. Option C, capillary. Option D, venule. The correct answer is option A, artery. Systemic arteries carry oxygenated blood away from the heart to body tissues. They operate under higher pressure and have thicker walls than veins. The pulmonary artery is an exception because it carries deoxygenated blood to the lungs. Question 64. When centrifuging specimens, what is the most important operational rule to follow? Option A, centrifuging serum tubes immediately before they clot. Option B, ensuring the centrifuge load is balanced by placing equal volume tubes opposite each other. Option C, leaving the lid open slightly to prevent overheating of the tubes. Option D, setting the speed to the maximum RPM regardless of tube type. The correct answer is option B, ensuring the centrifuge load is balanced by placing equal volume tubes opposite each other. Centrifuge tubes must be balanced with similar volume tubes opposite each other. An unbalanced load can damage the centrifuge, break tubes, and create aerosol or biohazard exposure. Opening the lid during operation or using maximum speed without regard to specimen type is unsafe. Question 65. How should a phlebotomist approach a child who needs a blood test? Option A. Tell them it will not hurt at all to gain their trust. Option B. Explain the procedure in simple, age-appropriate terms and ask for their cooperation. Option C. Have 3 guards hold them down before introducing yourself. Option D. Show them the largest needle to prove how brave they need to be. The correct answer is option B. Explain the procedure in simple, age-appropriate terms and ask for their cooperation. Children cooperate best when the procedure is explained honestly in language they can understand. Asking for cooperation while using calm reassurance promotes trust and reduces fear. Saying it will not hurt or showing an intimidating needle can increase distress and loss of trust. Question 66. What is the primary clinical consequence of warming an infant's heel prior to a dermal puncture? Option A. It decreases the pain perception of the infant. Option B. It increases localized arterial blood flow up to 7-fold. Option C. It sterilizes the deeper layers of the epidermis. Option D. It prevents the formation of an unneeded hematoma. The correct answer is option B. It increases localized arterial blood flow up to 7-fold. Warming an infant's heel increases local blood flow and improves capillary specimen collection. Better perfusion can reduce squeezing, which helps avoid tissue fluid contamination. Warming does not sterilize tissue or eliminate the need for proper puncture depth. Question 67. Which of the following is an example of a vector-borne transmission? Option A. Contracting a cold from an airborne sneeze. Option B. Acquiring a skin infection from a contaminated countertop. Option C. Getting bit by a mosquito infected with West Nile virus. Option D. Drinking water containing bacterial toxins. The correct answer is option C. Getting bit by a mosquito infected with West Nile virus. Vector-borne transmission involves a living carrier that moves an infectious agent from one host to another. Mosquito transmission of West Nile virus is a classic example. Airborne droplets, contaminated surfaces, and contaminated water represent other transmission routes. Question 68. Which of the following blood components is responsible for the initiation of the coagulation process? Option A. Erythrocytes. Option B. Leukocytes. Option C. Thrombocytes. Option D. Hemoglobin. The correct answer is option C. Thrombocytes. Thrombocytes, also called platelets, initiate primary hemostasis by adhering and aggregating at sites of vessel injury. They help form the initial platelet plug before the coagulation cascade stabilizes the clot. Red cells carry gases, and white cells primarily defend against infection. Question 69. If a phlebotomist must collect blood from a patient with an active, running foreline in both arms, what is the preferred option? Option A. Draw the blood from a capillary puncture if the tests allow. Option B. Turn off the for yourself and draw above the line immediately. Option C. Draw from the foot or ankle without a physician's order. Option D. Postpone the draw indefinitely until the patient is discharged. The correct answer is option A. Draw the blood from a capillary puncture if the tests allow. When both arms have running forelines, venous sampling near either infusion may be diluted or contaminated. If the ordered tests permit capillary collection, skin puncture can avoid the active infusion sites. Turning off force or using lower extremity veins requires nursing or provider direction and facility policy. Question 70. Which of the following conditions can lead to a lipemic specimen? Option A. The patient did not fast before a lipid panel draw. Option B. The specimen was hemolyzed during collection. Option C. The tube was left under direct light for too long. Option D. The patient was severely dehydrated. The correct answer is option A. The patient did not fast before a lipid panel draw. Lipemia often occurs when blood is drawn after recent dietary fat intake, especially before lipid testing. The serum or plasma may look cloudy or milky from circulating lipoproteins. Hemolysis causes a red tint, while icterus produces a yellow to amber color. Question 71. Which of the following tubes contains an additive that prevents clotting by activating antithrombins? Option A, light blue top, sodium citrate. Option B, green top, heparin. Option C, lavender top, EDTA. Option D, gray top, potassium oxalate. The correct answer is option B, green top, heparin. Heparin prevents clotting by activating antithrombin, which inhibits thrombin and other clotting factors. Green top tubes use this mechanism for plasma chemistry and selected special tests. EDTA and citrate work by binding calcium rather than activating antithrombin. Question 72. When performing a newborn screening, PKU, collection card, how must the blood be applied to the filter paper? Option A, layered drop upon drop until the circle is saturated. Option B, applied to both sides of the paper simultaneously. Option C, brought into direct contact with a single large drop to fill the circle completely. Option D, smeared across the surface using a plastic capillary tube. The correct answer is option C, brought into direct contact with a single large drop to fill the circle completely. Newborn screening filter paper should be filled by touching the paper to a large hanging drop of blood until the circle saturates. The blood should soak through evenly from one side without layering multiple drops. Smearing, scraping, or applying blood to both sides can invalidate the specimen. Question 73. If a patient experiences syncope during a venipuncture, what should the phlebotomist do first? Option A, call for an emergency code. Option B, complete the current tube collection. Option C, remove the tourniquet and needle immediately. Option D, place a cold compress on the patient's forehead. The correct answer is option C, remove the tourniquet and needle immediately. Syncope during venipuncture requires immediate protection from further injury. The tourniquet and needle should be removed first so bleeding and needle movement do not continue while the patient loses consciousness. Completing the tube collection is never the priority during a fainting episode. Question 74. Which of the following tests is used to evaluate the extrinsic pathway of the coagulation cascade? Option A, activated partial thromboplastin time, APTT. Option B, bleeding time test. Option C, prothrombin time / international normalized ratio, patient / INR. Option D, complete blood count, CBC. The correct answer is option C, prothrombin time / international normalized ratio, patient / INR. Patient and INR evaluate the extrinsic and common coagulation pathways. They are commonly used to monitor warfarin therapy and assess clotting factor activity. APTT primarily evaluates the intrinsic pathway, and CBC measures cells rather than coagulation pathway function. Question 75. Which of the following factors is a major cause of specimen rejection in the laboratory? Option A, collecting a lavender top tube for a CBC test. Option B, submitting an underfilled light blue coagulation tube. Option C, delivering a chemistry specimen to the lab within 4 to 5 minutes. Option D, affixing a handwritten label over a pre-printed barcode label. The correct answer is option B, submitting an underfilled light blue coagulation tube. Underfilled light blue coagulation tubes are a common cause of specimen rejection because the blood-to-citrate ratio is invalid. Excess citrate can alter clotting times and make results unreliable. Proper tube fill is more critical for citrate tubes than for many serum or EDTA tubes. Question 76. Which of the following scenarios describes the correct patient preparation for an oral glucose tolerance test, OGTT? Option A, the patient should eat a low-carbohydrate diet for 3 days prior to the test. Option B, the patient must fast for at least 8 to 12 hours before the baseline draw is performed. Option C, the patient should exercise vigorously right before drinking the glucose solution. Option D, the patient can drink black coffee or tea during the hours of the testing period. The correct answer is option B. The patient must fast for at least 8 to 12 hours before the baseline draw is performed. An OGTT begins with a fasting baseline specimen, usually after 8 to 12 hours without caloric intake. Food, coffee, or strenuous exercise can alter glucose metabolism and invalidate the test. A low-carbohydrate diet before testing can also distort the response to the glucose load. Question 77. Which of the following veins is located on the medial, inner, aspect of the antecubital fossa and is close to the brachial artery? Option A, cephalic vein. Option B, basilic vein. Option C, median cubital vein. Option D, radial vein. The correct answer is option B, basilic vein. The basilic vein is located medially on the inner side of the antecubital area. It lies closer to the brachial artery and median nerve than the preferred veins. This anatomical relationship is why it is usually avoided unless necessary. Question 78. When using a butterfly winged infusion set with a light blue top tube, why must a discard tube be drawn first? Option A, to clear any residual skin surface contaminants from the needle. Option B, to purge the air out of the butterfly tubing to ensure a proper fill volume. Option C, to activate the coagulation cascade prior to sample collection. Option D, to check if the vein has adequate pressure to fill a full tube. The correct answer is option B, to purge the air out of the butterfly tubing to ensure a proper fill volume. Butterfly tubing contains air that can reduce the fill volume of the first tube collected. A discard tube removes that air so a light blue citrate tube fills to the required level. The discard is not collected to clean the needle or activate clotting. Question 79. Which tube is typically utilized to collect samples for blood bank cross-matching and typing? Option A, pink top, EDTA, or plain red top. Option B, light blue top, sodium citrate. Option C, gray top, sodium fluoride. Option D, green top, sodium heparin. The correct answer is option A, pink top, EDTA, or plain red top. Blood bank typing and cross-matching commonly use EDTA pink top tubes or plain red top tubes depending on facility requirements. EDTA preserves red cell antigens and prevents clotting for many immunohematology procedures. Citrate, fluoride, and heparin tubes are used for other testing categories. Question 80. Which of the following additives is present in a light green top plasma separator tube, PSD? Option A, sodium heparin and a gel barrier. Option B, lithium heparin and a gel barrier. Option C, DDTA and a gel barrier. Option D, clot activator and a gel barrier. The correct answer is option B, lithium heparin and a gel barrier. Light green PSD tubes contain lithium heparin and a gel barrier. Lithium heparin prevents clotting, and the gel separates plasma from cells during centrifugation. SST tubes contain clot activator for serum rather than heparinized plasma. Question 81. What is the primary medical reason for avoiding the basilic vein for routine venipuncture procedures whenever possible? Option A, the vein is too small to yield an adequate sample volume. Option B, the vein is located in close anatomical proximity to the brachial artery and the median nerve. Option C, the vein has a high tendency to collapse under normal vacuum tube pressure. Option D, the vein lacks a sufficient path to the superior vena cava system. The correct answer is option B. The vein is located in close anatomical proximity to the brachial artery and the median nerve. The basilic vein is avoided for routine draws because it lies close to the brachial artery and median nerve. Injury in that area can cause significant bleeding or nerve symptoms. Safer veins should be selected first whenever they are available. Question 82. What is the liquid portion of an anticoagulated, centrifuged blood specimen called? Option A, serum. Option B, plasma. Option C, whole blood. Option D, fibrin clot. The correct answer is option B, plasma. Plasma is the liquid portion of anticoagulated blood after centrifugation. It contains clotting factors because clot formation has been prevented. Serum comes from clotted blood and lacks fibrinogen and many clotting factors. Question 83. What should a phlebotomist do if a patient experiences a sudden, sharp, shooting pain down their arm during a venipuncture? Option A, advance the needle deeper to see if the pain stops. Option B, terminate the venipuncture immediately, withdraw the needle, and assess for nerve injury. Option C, tell the patient that minor discomfort is completely normal for this vein. Option D, instruct the patient to keep their arm completely still while you finish filling the tube. The correct answer is option B, terminate the venipuncture immediately, withdraw the needle, and assess for nerve injury. Sudden sharp shooting pain down the arm suggests possible nerve contact. The venipuncture should be terminated immediately, the needle withdrawn, and the patient assessed according to policy. Continuing or redirecting the needle can worsen nerve injury. Question 84. Which of the following statements is true regarding standard precautions in healthcare settings? Option A. They apply only to patients with known, documented infectious diseases. Option B. They mandate that blood and all body fluids must be treated as potentially infectious regardless of the patient's perceived status. Option C. They require healthcare workers to wear a full gown and face shield for every routine venipuncture. Option D. They permit the recapping of used needles as long as you use two hands. The correct answer is option B. They mandate that blood and all body fluids must be treated as potentially infectious regardless of the patient's perceived status. Standard precautions require treating all blood and body fluids as potentially infectious. This approach protects healthcare workers and patients regardless of diagnosis or appearance. Selective precautions based on perceived risk miss infections that are unknown or asymptomatic. Question 85. What is the clinical term for blood that has escaped from a vessel into the surrounding tissue layers? Option A, petechiae. Option B, hematoma. Option C, thrombus. Option D, hemostasis. The correct answer is option B, hematoma. A hematoma is blood that has leaked from a vessel into surrounding tissue. It may appear as swelling, bruising, or tenderness at the puncture site. Petechiae are pinpoint hemorrhages, while a thrombus is a clot inside a vessel. Question 86. What is the appropriate antiseptic choice for blood culture site preparation in patients older than 2 months? Option A, 70% isopropyl alcohol alone. Option B, chlorhexidine gluconate or tincture of iodine. Option C, sterile saline solution. Option D, benzalkonium chloride. The correct answer is option B, chlorhexidine gluconate or tincture of iodine. Blood culture site preparation must strongly reduce skin flora to prevent false positive cultures. Chlorhexidine gluconate or tincture of iodine is commonly used for patients older than 2 months, depending on policy. Alcohol alone is not sufficient for many culture protocols, and saline is not an antiseptic. Question 87. What should a phlebotomist do if they note a discrepancy between the patient's spelling of their last name on their wristband versus the lab order? Option A, correct the spelling on the band using a waterproof marker. Option B, proceed with the draw as long as the first name and birth date match perfectly. Option C, hold the procedure and contact the nursing staff or registration to correct the identification bands before drawing blood. Option D, assume the lab order has a typographical error and proceed with the draw. The correct answer is option C. Hold the procedure and contact the nursing staff or registration to correct the identification bands before drawing blood. A spelling mismatch between the wristband and lab order is an identification discrepancy. Collection should be held until nursing staff or registration resolves and documents the accurate identifiers. Drawing first and fixing labels later risks a wrong patient specimen. Question 88. What is the standard duration for an administrative scrub or hand washing when preparing for routine patient contact? Option A, 5 seconds. Option B, 20 seconds. Option C, 1 minute. Option D, 3 minutes. The correct answer is option B, 20 seconds. Routine hand washing before patient contact should last at least 20 seconds. This duration allows adequate friction and contact time to remove transient microorganisms. Very brief washing is ineffective, while surgical scrub times are reserved for different procedures. Question 89. Why is the first drop of blood wiped away during a capillary puncture? Option A, it contains skin surface bacteria. Option B, it contains tissue fluid contamination. Option C, it hemolyzes too rapidly to be accurate. Option D, It clots too quickly to be collected. The correct answer is option B. It contains tissue fluid contamination. The first drop from a skin puncture often contains tissue fluid and surface contaminants from the puncture process. Wiping it away improves specimen quality and reduces dilution of the sample. Collecting that first drop can contribute to inaccurate chemistry or hematology results. Question 90. What should a phlebotomist do if they encounter an aggressive, uncooperative psychiatric patient accompanied by an order for blood work? Option A. Enlist colleagues to restrain the patient by force without nursing guidance. Option B. Postpone the draw and consult with the nurse in charge of the patient's care. Option C. Attempt to draw blood while the patient is asleep. Option D. Cancel the test order permanently on your own authority. The correct answer is option B. Postpone the draw and consult with the nurse in charge of the patient's care. An aggressive or uncooperative psychiatric patient requires a safety-focused pause and coordination with nursing staff. The care team can determine whether the draw should be delayed, supported, or handled under a specific behavioral plan. Drawing while the patient sleeps or using force without guidance creates serious safety and legal risks. Question 91. Which of the following additives is found in a yellow top blood culture tube? Option A. Sodium polyethylene sulfonate, SPS. Option B. Acid citrate dextrose, ACD. Option C. Dethylenidamine tetracetic acid, EDTA. Option D. Sodium citrate. The correct answer is option A. Sodium polyethylene sulfonate, SPS. Yellow blood culture tubes contain SPS, which supports organism recovery by limiting complement and phagocytic activity. It also provides anticoagulation for the culture specimen. ACD yellow tubes are different and are used for cellular or genetic testing. Question 92. What type of transmission is prevented by wearing an N95 respirator when working with a patient who has active tuberculosis? Option A. Droplet transmission. Option B. Contact transmission. Option C. Airborne transmission. Option D. Vector-borne transmission. The correct answer is option C. Airborne transmission. Active tuberculosis is spread by airborne droplet nuclei that can remain suspended in the air. An N95 respirator helps filter inhaled particles when entering an airborne isolation setting. Surgical masks are used for droplet precautions, and gowns or gloves address contact risks rather than airborne inhalation. Question 93. What does the term lipemia describe? Option A high concentration of broken red blood cells giving serum a red tint. Option B. A milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Option C. A dark yellow or amber tint in serum caused by elevated bilirubin levels. Option D. A clear, watery fluid component lacking any cellular proteins. The correct answer is option B. A milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Lipemia describes a cloudy or milky serum or plasma appearance caused by high lipid content. It commonly follows recent fatty meals or certain metabolic conditions. Hemolysis appears red or pink, while icterus appears yellow to amber. Question 94. What type of consent is assumed when an emergency department patient is unconscious and requires immediate life-saving laboratory work? Option A. Expressed consent. Option B. Informed consent. Option C. Implied consent. Option D. Verbal consent. The correct answer is option C. Implied consent. Emergency implied consent applies when an unconscious patient needs immediate life-saving care and cannot provide permission. Necessary laboratory work may proceed under facility policy to support urgent treatment. This differs from routine outpatient cooperation or signed informed consent. Question 95. What is the proper clinical intervention if a hematoma forms rapidly under the skin while you are drawing a patient's blood? Option A. Press down hard on the needle to flatten out the swelling. Option B. Release the tourniquet immediately, pull the needle out, and apply firm pressure to the site. Option C. Switch to a larger vacuum tube to pull the pooled blood out of the tissue. Option D. Continue the draw until all ordered tubes are filled completely. The correct answer is option B. Release the tourniquet immediately, pull the needle out, and apply firm pressure to the site. Rapid hematoma formation means blood is escaping into tissue during the draw. The tourniquet should be released, the needle removed, and firm pressure applied to stop the bleeding. Continuing the collection or trying to drain the swelling through the tube can worsen injury. Question 96. Which of the following is a primary duty of a phlebotomist regarding quality assurance? Option A. Interpreting abnormal lab results for patients. Option B. Ensuring specimen tubes are collected, labeled, and transported correctly. Option C. Changing medication doses based on therapeutic levels. Option D. Performing complex tissue biopsies in the operating room. The correct answer is option B. Ensuring specimen tubes are collected, labeled, and transported correctly. Phlebotomy quality assurance focuses on collecting, labeling, handling, and transporting specimens properly. These pre-analytical steps have a major impact on result accuracy. Interpreting results, changing medication doses, or performing biopsies is outside the phlebotomist's usual role. Question 97. Which of the following scenarios is considered a breach of the Health Insurance Portability and Accountability Act, HIPAA? Option A. Discussing a patient's laboratory results with the ordering physician. Option B. Discussing a patient's lab results with a colleague in the hospital cafeteria. Option C. Entering patient information into an encrypted laboratory information system. Option D. Sharing critical panic values with the nurse assigned to the patient. The correct answer is option B. Discussing a patient's lab results with a colleague in the hospital cafeteria. Discussing patient results in a public cafeteria exposes protected health information to unauthorized listeners. HIPAA permits sharing information for treatment with authorized team members, but only in appropriate settings. Casual conversations in public areas violate confidentiality even when the colleague works in healthcare. Question 98. Which of the following is considered an acceptable site for venipuncture if antecubital veins are unavailable? Option A. The dorsal aspect of the wrist. Option B. The dorsal aspect of the hand. Option C. The anterior aspect of the foot. Option D. The saphenous vein in the ankle. The correct answer is option B. The dorsal aspect of the hand. Dorsal hand veins are an acceptable alternate site when antecubital veins are unavailable. They are more superficial but may require a smaller needle and careful anchoring. Wrist, foot, and ankle sites carry greater risk and often require special approval. Question 99. What does the term erythema mean? Option A. Redness of the skin caused by congestion or inflammation of the capillaries. Option B. A pale appearance of the skin due to low red cell counts. Option C. A bluish tint to the skin caused by a lack of oxygen. Option D. A yellowing of the skin caused by high bilirubin levels. The correct answer is option A. Redness of the skin caused by congestion or inflammation of the capillaries. Erythema means redness of the skin from capillary congestion or inflammation. It may be seen with irritation, infection, allergy, or localized trauma. Pallor, cyanosis, and jaundice describe pale, blue, and yellow color changes. Question 100. Which antiseptic is recommended for a patient undergoing a skin puncture for a blood culture if they are allergic to chlorhexidine? Option A. 70% ethyl alcohol. Option B. Povidone. Option C. Hydrogen peroxide. Option D. Benzalkonium chloride. The correct answer is option B. Povidone. Povidone is an appropriate alternative when chlorhexidine cannot be used for blood culture skin preparation. It provides broad antimicrobial activity when applied and allowed to dry according to protocol. Hydrogen peroxide and benzalkonium chloride are not standard substitutes for this purpose.